Hi, my name's Andy from the British Veterinary Hospital, and we're going to talk about vomiting in your animals. When to worry about it, when is it likely just to be a normal thing. Anyone who has an animal will have gone through it. You know, you wake up in the morning and you find a pile of something and you probably don't know which animal's done it because they both look bright as anything. Most of the time, in fact the vast majority of the time, vomiting is really not all that much to panic about. You know, I don't go to the doctor every time I've got a poorly tummy, and you know the same really applies to your animals. There are situations though when you really should be seeing an animal, and it's the question is when to do it. You know, when to bring your animal, when to call a vet. The honest truth is, just get us on the phone, and we'll tell you if we're worried enough to see him. Let's have a chat about those animals that are vomiting every now and then. I've had quite a few clients that have asked me to work these up. You know, your typical case is a cat that sort of is vomiting, maybe once or twice a week for a few months, and then doesn't do anything for a few months, and then vomits, 3 times a week for a few months. There's no rhyme or reason to it, but they just tend to be a bit sickly. I always put the disclaimer when people want me to work these cases up that the honest truth is that most of the time we don't find anything at all. It's not the wrong thing to investigate, absolutely not, but most of the time we're not going to find anything, and it is normal for that animal. So my advice tends to be, if your animal is just vomiting sporadically, but in itself isn't losing weight, doesn't look poorly, is quite bright in itself and doing everything that you would expect a cat to do, then the honest truth is I might come for some advice, but my advice is probably going to be let's not bother with this just yet, unless things change. When I say unless things change, we're really talking about an animal that starts losing weight, when the frequency of the vomiting starts to increase, or when you start getting other signs like chronic diarrhea as well as vomiting and everything else. Once the picture starts changing, we really do want to start investigating. And often what we would end up doing is probably running a blood test, probably doing a fecal analysis just to make sure there aren't any parasites or anything like that going on, and we can go from there and see where we go. That's what I would really call chronic vomiting. There's another situation where we're talking about acute vomiting, and those tend to be mainly in dogs, and you see it more in dogs than you do in cats. But you've got the typical picture is a dog that's gone into the bin, he's pulled something out, he's made himself really, really sick, and he pretty much deserves it for what he's done. And you've got a dog that's has been vomiting probably 10 times over the last 4 hours, and he's really looking miserable. I would tend to say those dogs that are vomiting that regularly I want to see, because the one thing that I don't want them doing is becoming acutely dehydrated or getting what we call electrolyte imbalances. The stomach contains lots of sort of acid, as we know, and by continually vomiting you can get sort of an imbalance in the acidity or the alkalinity of the blood. What we essentially want to do is we want to stop an animal vomiting so they're not losing any more fluids, and if they are significantly dehydrated, I would almost always recommend putting them on intravenous fluids to just stabilise them, rehydrate them quickly, and go from there. We wouldn't always do blood work or a lot of investigations on these guys. We tend to just treat them symptomatically, and if they're not responding to that treatment, we would then go and investigate further. There are plenty of drugs at our disposal to stop an animal vomiting, and what I tend to feel is that animals that really look, for lack of a technical term, they really look pretty grim. They really do not look like they're going to do. You get a gut feeling, if you excuse the pun, and you just want to go in and you just want to do the investigation. Those are what I would really put under the term of an acute abdomen, and the ones that I'm worried about. Things that can cause an acute abdomen would be things like pancreatitis. Those are animals that would be vomiting quite regularly, and aren't responding to treatment. Or, another example would be a Labrador that really has eaten something it shouldn't have done that is not sort of digestible. Something like, in my time I've pulled out boxer shorts, stones, socks, an entire carpet in one dog that he's just managed to chew his way through. Those dogs that tend to require surgery, what we would always end up doing is an X-ray and usually an ultrasound scan as well to get as much information as we can before we go in. Rule of thumb is, if you have any questions at all, at the very, very least, get us on the phone. A phone call is completely free. If you want to book an appointment, I would always recommend it. I would rather see an animal too soon than too late. Thank you very, very much, and if you have any questions, feel free to contact us. Bye-bye.